And just like that, her baby died. Imagine this. A patient who is about 17 weeks along presents to the emergency room with some vaginal spotting. She thinks it's related to some first trimester bleeding she had when she was given a diagnosis of a subchorionic hematoma. Unfortunately, she's found to be about 3 centimeters dilated. Now, for perspective, women have to be about 10 centimeters dilated in order to push a baby at 40 weeks. But this patient, who's only 4 months along, is already 3 centimeters dilated, meaning that she's likely to have a baby born preterm. And that baby at this current gestational age will be unable to survive outside of the uterus. Now, unfortunately for this patient, she loses her baby because the baby is born too early and there's no measures that can be offered to save the baby. But this is a classic presentation for cervical insufficiency. Cervical insufficiency is defined as painless cervical dilation. That means your cervix is dilating without pain. She just came in for vaginal spotting. Now, in her subsequent pregnancy or in her next pregnancy, we talked to her about placing a cerclage, which is a surgery that's done where we place a stitch around the cervix in order to close that cervix and prevent a preterm delivery from happening. She gets her cerclage done and eventually makes it all the way to 37 weeks where she delivers her baby vaginally after the cerclage is removed. If you have a history of a preterm birth, please talk to your doctor about cervical length screening. Based on your history, you may be eligible for a cerclage, which would then prevent your baby from being born early and could be a life-saving measure for you and for your baby.